The stroke programme is one of 7 programmes in the Greater Manchester CLAHRC. It's probably the longest established programme that we've got because it was part of CLAHRC 1, the first round of CLAHRC funding.
The work that CLAHRC does around stroke is really important because it's actually looking at real life problems. That was the first time we got to sort of work with researchers on a sort of national priority, so it's issues in terms of gaps in service provision or things that are really important to stroke survivors and carers, and then working with providers like the Stroke Association to find solutions. A lot of attention has been paid on the hospital end of stroke care, and now it's really important that the community end of stroke care gets the same sort of attention. And CLAHRC are exactly the right sort of organisation to make sure that that focus on the community happens and that stroke care in the community gets better.
We're delivering impacts around carer support and making sure that this question of who cares for the carer is addressed through the Stroke Association.
The latest study in the stroke programme is one called OSCARS. It stands for Organising Support for Carers of Stroke Survivors. So we've developed an approach that looks at how we identify carers' needs and how we provide support for them and organise that as well. And we've developed the approach for stroke by collaborating with the Stroke Association and a really wonderful group of people who care for stroke survivors themselves.
I think it's going to make a massive difference. I think it's going to help focus some of the interventions that they're already making, but specifically around carers and the caring role.
It's good to know that what I'm doing will help carers in the future, because when I first started caring, we didn't have all this sort of help that we're getting now.
It should make a big difference knowing that everything is going to be organised right from the start.
CLAHRC developed a tool for supporting 6-month post-stroke reviews. It's called the GMSAT, or Greater Manchester Stroke Assessment Tool. That tool is now one of the most widely used over the country, and stroke professionals find it quite valuable. We also make the things that we develop freely available and disseminate widely, so that they've got the best chance of being taken up and implemented in practice.
Working in the voluntary sector is quite complex, as working in the NHS and health and social care is. But what the CLAHRC team are good at is adapting the work that they do with us to suit the environment we work in. I think the Stroke Association and the type of support that we provide can often be quite hard to quantify and evaluate and define. And we know the emotional impact of stroke is devastating, and yet the support isn't really out there in the way that people need it. So I think there's a lot of areas that we could see ourselves working together on in the future.